because it's a terminal disease. This is the disease they're going to die from.
It's estimated more than 6.7 million Americans over the age of 65 have Alzheimer's. It's a disease that right now has no cure, and it impacts entire families. But there is hope with the development of new drugs that are proving to slow the progression of Alzheimer's down. But at the same time, there are questions about whether those who are most at risk of developing Alzheimer's will have fair access to this new medicine.
I love this one, the story behind it. We had a father-daughter night with my princess. It was supposed to be for small kids.
These pictures represent some of Sylvia Waller's most cherished memories with her dad.
So we get there and he said, "Why are we the oldest here?" And I said, "Well, it's a night with my princess." And I said, "I'm still your princess." And he said, "Yeah." So that was the last night we danced.
Roughly 2 years after this night, Waller's father, James, passed away from Alzheimer's in 2017. An only child, she took care of her dad until his death.
It was a tough one because the roles had changed. I was no longer his baby girl. I was his caregiver.
There was no approved Alzheimer's treatment for Waller's dad, but she says the FDA approval of Leqembi offers hope. The treatment is a twice-a-month IV infusion for patients who are in the early stages of the disease that's been proven to slow Alzheimer's progression by as much as 27%. Waller does worry about access, especially to those in the Black community, which is twice as likely to develop Alzheimer's compared to those who are white. Experts say health issues like higher rates of heart disease may play a role, but research has yet to identify a cause.
News is exciting that we're now in a treatment phase. And yay, but then there's a wah, wah, wah.
A big concern is the price. Medicare will cover most of Leqembi's cost of more than $26,000 a year. But the Centers for Medicare and Medicaid Services tells me patients will still likely have to pay 20% of the cost, which is more than $5,000. Add that to the total out-of-pocket costs of caring for an Alzheimer's patient. The Alzheimer's Association estimates it to be on average more than $238,000 from diagnosis to death.
The majority of the people who have Alzheimer's are on Medicare, and they're not the 10% or the 1%, who have money, have a great retirement fund.
A lot of tests are not available in Spanish, so a lot of my cognitive tests I have to pull from Mexico or from Spain.
I met with Fabian Consbrough. He's a clinical psychologist outside Denver who works closely with the Hispanic community, which is 1.5 times more likely to develop Alzheimer's. He puts patients through cognitive tests that can lead to a diagnosis.
What's the moment like when you have to tell a patient that they have Alzheimer's?
That is just as bad as giving someone a cancer diagnosis, because it's a terminal disease. This is the disease they're going to die from.
For as difficult as a diagnosis may be, he says getting help also can be hard because of the several steps and medical professionals dementia patients often need to meet with to get treatment. He worries Leqembi will be out of reach for many of his patients.
Not only do they need to get the diagnosis, they need to get the referral back to the specialist or back to their primary care doctor. The provider has to be caught up on the medication and feel comfortable with that medication.
Leqembi is meant to treat those who are in the early stages of Alzheimer's, which Jim Herlihy with the Alzheimer's Association of Colorado says makes access important.
And every day, 2,000 people advance to another stage of the disease. So having access to these medications right now is critical for those people and their families.
In 2022, with Alzheimer's awareness as her platform, Waller won Mrs. Colorado.
At the time, I was like 60, and I've learned that no matter how old you are, you continue to grow.
She says while new drug developments are a major step forward, making sure people know the signs and symptoms are an important part of the fight against a disease that still has no cure. Chris Stewart, Scripps News, Denver.